Hello everyone. So today's topic is menopause. Menopause is that time in a woman's life that marks the end of her menstrual cycle as a result of a natural decline in her reproductive hormones. It is associated with the absence of 12 months of menstrual period. Menopause is a natural biological process. It can happen during early 40s or late 50s. Menopause process is a gradual process. This process is called premenopausal transition. The premenopausal period is the time around the menopause and it varies among different women. And this transition period mostly begins about 4 years before the last period. This premenopausal transition is characterized by an irregular menstrual period. That is, the period will skip a month and then return, or may skip for several months and then the regular cycle starts for a few months. Menstrual flow may also get heavier or lighter. Let's know the causes. The major cause of menopause is the decline in a woman's reproductive hormone. At this time, the function of the ovaries ceases and no chance of pregnancy. The reproductive gland is made up of the ovaries located in the pelvis, one on each side of the uterus. The ovaries produce estrogen hormone, a woman hormone, and egg. So, egg is released at the ovary during each menstrual cycle monthly. This egg travels down from the ovary to the uterus through the fallopian tube. The aging of these ovaries leads to less production of reproductive hormones. So, this in turn leads to loss of active ovarian follicles that allows menstruation and fertility. Menopause is induced in some cases. This may be as a result of surgical removal of the ovaries or caused by the injury. Cancer, chemotherapy, and radiation therapy can also lead to an induced menopause in women. So let's move on to the signs and symptoms of menopause. The first is vaginal dryness, itching, and dryness. This results in the thinning of the vagina lining as a result of the estrogen level dropping. Tiredness, fatigue, mood changes. Insomnia, thinning of hair or hair loss, weight gain in some women, reduced sex drive, sore or tender breast. There may be increased hair on some part of the body like neck, face, back, or chest. Hot flushes. This is a feeling of warmth that spreads over the body and more pronounced in the head and the chest. Night sweats. Urinary symptoms. The declining estrogen level hormones results in the thinning of urethral lining and can cause dryness, itching. So this can lead to a risk of urinary infections and causes a constant urge to urinate. Coming to diagnosis and treatment. So there is no single test for diagnosis of menopause. However, a doctor can carry out a test that will measure the level of hormone in the blood. Usually that is FSH test, follicle stimulating hormone test. This FSH helps to control the menstrual cycle and production of eggs in the ovaries. So an increased FSH blood level of 30 ml or higher combined with 12 consecutive months of no menstrual flow is usually a confirmation of menopause. So it is always advisable to talk to your healthcare provider if you're 45 years or younger and you're experiencing disabling menopausal symptoms. So coming to homeopathic management in menopause cases, there are wide range of medicines to manage the symptoms of menopause. Homeopathic physician treats these cases by considering symptoms, constitution, modalities, rheumatism, etc. So based on individuality and the totality, can decide the well-indicated homeopathic remedy for treating these premenopausal symptoms. So let's see some few of the mostly indicated homeopathic remedies in premenopausal cases. The very first effective homeopathy remedy is sepia. This can be helpful if a woman's periods are sometimes late and scanty but heavy and flooding at the other time. Women may be craving for vinegar or sore foot. So peculiar symptom will be women will be in loss of interest in daily task. Exercise, especially dancing, may brighten up woman's mood and improves her energy. Sepia can be taken in 30 potency or 200 potency. Next is Calcarea cough. This remedy may be helpful to a woman with heavy flooding, night sweats, and flushing despite a great chilliness, as well as weight gain during menopause. People who need this remedy are usually responsible and hardworking. stiff joints or cramps in the legs and feet, and craving for egg and sweets are other indications for calcarea cup. This can be taken in 30 potency or 200 potency. The next remedy is natramur. It is highly and very effective in treating menopausal symptoms. A woman who needs this remedy may seem reserved but has strong emotions that she keeps inside. She often feels deep grief and may dwell on the loss of happy times from the past. During menopause, she can have irregular periods accompanied by backache or migraine. A person who needs this remedy usually craves salt and feels worse from being in sun. Nadramur 6x can be taken in this menopausal symptoms. Thank you for watching my video, and please do not forget to subscribe my channel, and also please do like and share the video with your friends and relatives. Till then, take care.